Good morning, everyone. So I'd like to share with you the feedback from the workshop that we had last year on November 9 on how to build an inclusive society for PMIs. So why the need for community integration? One, as you can see, as shared earlier, the statistic is really worrisome. All right, we need to ensure that we have a way to integrate PMI into our society so that they can contribute meaningfully to everyone's lives. Now, as you know, family members suffer objective burdens, are really in need of support. The objective burdens are in the form of financial, family, conflicts, as well as work, balancing work and caregiving challenges. So therefore, having the right support system is really crucial. When we look at the illness today, clearly there is a stigma in the society. Are we ready to accept that mental illness is just another form of illness? Are we even there yet? In my opinion, I don't think so. It does require a transformation of mindset. And if we have ways to integrate PMIs into the community, it really helps to lift the dignity and self-worth for them. We have identified 6 key pillars, which will be the key strategies to help PMI to normalize recovery and making them ready for community integration. The 6 key pillars are social and community inclusion, education inclusion, employment inclusion, all right, public policy changes, caregiver inclusion, as well as healthcare inclusions. Why do we select that 6 key strategies? Basically, there are 3 stages of recovery for PMI. The first stage is recuperation. The recuperation phase is essentially a crisis phase. And the needs of the consumer is basically, they need a lot of rest. They need someone to care for them, and they need proper treatment. So therefore, during this phase, the 2 key strategies that are critical to support the consumers are really caregiver inclusion and healthcare inclusion. The next phase on rebuilding is a phase where they need people to believe in them. The consumer is also a stage for them to learn and relearn. And it's also time where they start to socialize. So therefore, at this stage, I think social and community inclusion and education inclusion is critical. The third phase is discovery, and that will be the best phase because it's an awakening phase for the consumer. And here, the needs are essentially, they need people to appreciate them. And this is a time they look for meaningful work, all right? And therefore, employment inclusion and public policy changes will really help this consumer. So let me elaborate some of the key feedback and the support that's required by the caregivers in having a better society to cater to the needs of the consumer. The first one on caregivers. Clearly the concern here is for elderly caregivers who are generally parents or spouse or parents. They are looking at long-term residential care for the young ones so that there is a succession in caregiving for their children continuing into the old age. But this long-term residential care need to be equipped with the right facility and infrastructure by such as overnight help desk, housekeeping services, and it needs to be linked to crisis management services as well. Right? Next, on healthcare. Today, healthcare tend to be very reactive in nature. Can we shift to a continuum of care instead? And here I would also link to multidisciplinary team of care approach, where you have a team of doctors, psychologists, counselor, caregivers, and case manager working together to support the consumer. And in reality today, in the hospital sometimes, the consumer need not necessarily see the same doctor in the follow-up visit. So by having this, you have a set of team that will truly understand the consumer, and there will be proper follow-through. Most of the service at the hospital today looks at addressing, it's very task-based oriented when you go to the hospital, in the follow-up visits and all that. Now, there is also a need to address the psychosocial needs of the consumer and the caregivers. So it's not just the medicinal part of it, the other aspect is also important for a holistic way of caregiving. There is also a need as we look at bringing care closer to the community itself to facilitate integration in the community. So if we make those care accessible at this area in terms of general practitioner, community mental health centers, polyclinics and all that, it can reduce stigmatization of the illness. And last but not least, there is, caregiving is a heavy toll responsibility. And in some cases, the caregiver have to give up the full-time job to make sure that they can provide proper caregiving to the consumer. So therefore, for those caregivers who need financial support, which is essentially, I think, a critical factor to ensure that they can get by with the day-to-day living, it would be good to have an income support for full-time caregivers. Now, in North Ireland, Scotland and Wales, they have such a program for income support for caregivers below 60 years old. All right, and today, we don't have such a subsidy program, but we do have CDC support for the consumer themselves. But those are subjected to 3 months review. And we also help the caregivers if it could be extended to an annual review, because you don't have to have the caregivers having to do the administrative work to do the follow-up to ensure that they get the continuity of the CDC support. So these are some of the supporting infrastructure that we could provide as an access to caregivers. Actually, for me to add to that as well is that in Northern Ireland and in Scotland and Wales, they also had what you call as disability living allowance for the consumer. And in Singapore, I think the bigger question is mental illness categorized under disability? All right, I think if it's categorized under disability, and that support will come true. But that will be a big question for Singapore to address. Now, on educational inclusion, it is good to inculcate inclusive behavior and empathy by implementing outreach programs for support in school. This is one way to minimize stigma. And if you start from young, for the youngs to embrace the understanding of this illness, it really helps to broaden their thinking and to also develop empathy over time. Now, school needs to be equipped to accommodate consumer so that there is a proactive hand-holding to ensure that the consumer can complete their education. So those programs today are not formalized, but there is much to be done at the school level to have early intervention to ensure that the consumer have a good future indeed. Now, on social and community inclusion, there needs to be an educational campaign to educate the public. But in this case, we could start first in the school and the workplace so that you increase awareness of the illness and the consideration of the empathy, because sometimes by not being aware, you do discriminate because of lack of awareness and lack of knowledge, rather than having the intent to discriminate. Now, on employment inclusion, the suggestion by the caregivers is to have an organization to promote employment inclusion policy under an umbrella of disability. Now, in UK, they have an organization known as Mindful Employer Network. Okay, this organization basically promote employment inclusion, and they train the senior management and the line managers in the organization to prepare them to hire PMIs. So I think this is a good effort, and it is a collaboration of Center for Mental Health, also a collaboration with the Commission Rights for Disability. So this effort is not a single organization, but it involves a larger network of organizations to enable this. There's also suggestion to extend workfare programs such as employment credit scheme to encourage employers to hire PMI. All right, this scheme today is available for SME organization, but it will also, given the fact that there is a shortage of manpower today, that certain jobs we could consider hiring PMIs who are in their discovery phase. Now, rehabilitation centers provide training so that the consumers are ready for the workforce. The suggestion here is to also expand it to specialized or industrial training, but that would require funding support from the government. Right? So I shall end with a note from Bill Clinton. Mental illness is nothing to be ashamed of, but stigma and bias shame us all. Thank you.